Hi guys, my name is Karen Dees and I am the Marketing Manager for Patient Concierge Services. For those of you that don't know what PCS is we do a full wraparound service supporting clients from all over the world, but mostly Australia, visiting Bali for cosmetic surgery. We can organise the appointment for you, we can do the concierge, we can chaperone you throughout all of your appointments, as well as the aftercare when you're back at your accommodation. And part of our service is we get to talk to amazing doctors and surgeons. So we have a Facebook page and a Facebook private group called STAR, which is Surgical Transformation and Aesthetic Rejuvenation. And we're also really good friends with Pamela Lovegrove, who has Facelift in Bali. And I think there's like 24,000 people in that group. And we see all of these questions coming up all the time. You know, how do I get surgery in Bali? Is it safe? What are the surgeons like? What type of facelift do I get? So my job is to try and give you as much information as possible. So today we are in Nulook, a beautiful clinic located in Legian Seminyak. It's like on the cusp, would you say?
Yeah.
Yeah, so it's really good in terms of accessibility if you like to stay in the Legian area. So without further ado, Dr. Sita.
Hi.
Please, can you tell us who you are and a little bit about yourself?
Okay, hi. I'm Dr. Sita. I'm a plastic reconstructive and aesthetic surgeon from Bali. I'm born and raised in here. I work now here in my beloved place. So I've been a plastic surgeon since maybe around 5 to 6 years, and then getting so many patients, especially with PCS from Australia,
Yeah.
do as cosmetic surgery here, and it's really like helpful. It's really helpful for the patient to do the surgery here, and PCS is there. You know, it's
Support them, yeah.
they were like really feel safe when different with patient who came here alone. They start to feel a little bit nervous.
Yeah.
And during the consultation, maybe they're like nervous, and then but when you guys there, they feel like so much at ease. That's
Oh, thank you for saying that. I wasn't expecting you to talk about us then, but it's very nice to hear that we do
Yeah.
really help with the nerves and the anxiety. Yeah. So you've been a plastic surgeon for about 6 years.
Yes.
Yeah.
Yeah, I've been. I was graduated at some 20. Yeah, I guess. And then I start by 2021, and then I start with reconstructive first, and then I start with aesthetic now for about four years.
Ah, okay. Yeah.
And in New Look, I feel blessed because I've been with so many mentors, especially from Korea, because
Yeah.
this one is a Korean clinic, and so many different kind of technique, different procedure that they gave me. They teach me to do the procedure that we can do in our lovely clinic here. So it's really a blessing to work here.
That's a really good piece of information, actually. Is this? It's a Korean clinic, so I guess there's a whole menu and repertoire of choice in Bali of clinics and hospitals, but that's what makes Nulook stand out.
Yes,
Is it's a Korean clinic, so
Yeah.
it has Korean standards.
Yes.
And obviously Indonesian standards are high anyway, so you have a Korean influence.
Yes.
So did you go to Korea to have any training at all?
For now, not yet.
Okay.
But I will be, and then a few of our mentors from Korea
Yeah.
came here, and it's like what we call it every 3 to 4 months. A few mentors.
You have Korean doctors that come over to give some mentoring? I didn't know this. That's a good.
They give mentors, or if they can't came, they give mentoring through online video.
What does mentoring look like?
Usually a new technique that they have.
A surgical technique?
Yes, a surgical technique, or in our clinic have like a specific procedure with the SPF, the stem cell.
Oh, the stem cell,
thing.
yes.
And
Yeah.
then usually if they got some updated info or updated procedure, they usually contact me or and our staff here to get more
Yeah.
information about that, because that is one of our like what we call it,
Like a unique selling service.
yes,
It's like,
something
yeah.
like that.
Yeah.
Because yeah, and we in our clinic it's like we are the first who get the stem cell in from our own factory.
Our own body.
Yeah.
I think we could do a whole interview talking about the stem cell treatment,
yes.
because I think you have like a huge list of things that you can do. So let's just, we won't have time to go through all of them in detail, but let's just list them all. So starting from the head to the toe, you can do bleph, obviously.
Bleph,
Upper, lower.
upper, lower.
You can do muscle, fat.
Muscle, fat repositioning, fat growth.
Okay. Can you do brow lifts?
Brow lift, temporal lift around here.
Okay. Just a quick one on the brow lift, because I see this question coming up a lot. There's two different types, is there? There's the one that's the fox eye, and there's one that you can lift from the ear. What are they called?
This one is the brow lift.
That's the brow.
Yeah, and we have it also the one the sub brow. So
is that the fat underneath the eyebrow?
Yeah.
Okay.
Just to remove, you have the bulginess around your face, and they say like we have a higher brow bone and something, but it's not actually your bone, but it's your skin who is start to coming down. Yes.
Just a quick one on that. Anyone who's watching who thinks that they need bleph or some type of opening up the eye, it's good to have a consultation with you and find out, do you need bleph, or do you need a sub brow, or do you need a temporal
lifting or brow lifting?
Yeah. So there's 4 things. And we don't know which one, so we can arrange a consultation to find out. Okay, so we've got the brow lift, the bleph, nose.
With the implants usually, because we have here, usually we have the implants one, or just using the cartilage from our ear.
So if you're using an implant or cartilage, that's on the assumption that you need to build it up.
Yes.
So that would probably be maybe not Caucasian, or
yes. Usually more Asian people.
Okay.
Local people usually.
Okay.
Because they usually.
Because they normally have lower noses.
Short and lower one.
Yeah. And if it's Caucasian and they want to go smaller, you can do this.
Yes.
And is it done on local or general?
Usually general.
Okay.
Just a slight sleeping anesthesia.
Okay. Okay, let's move on to the lips. And this is so exciting for me, by the way. I feel like I'm inside a sweet shop. I love cosmetic surgery. I love anything that empowers a woman and a man. So,
lip lift.
I don't know all the correct medical terms, but I think there's 2 different types of lip lifts. There's the bull ring, is it called? So you reduce the distance between the nose and the lip. And then I've seen another one that I've noticed another surgeon do, and Dr. Vivi does it, and she goes around the lip line. And I think that's called a gull wing.
Yes.
Yeah.
But what I do usually in the here is usually the bull ring.
Yeah.
Because it makes your lip more plumper,
Plumper from here. Yeah.
Because sometimes when people who have a thin lip over aging because of they get smaller one, this shorten will make more appealing.
Okay. But you can do both?
Yeah, but I prefer the
bull ring.
The bull ring one.
I've noticed maybe ladies who have smoked all their life are usually better opted to the gull wing. But if you haven't been a heavy smoker and you don't have deep smoker's gland, then you can have the bull ring.
Shortening from this, we call it columella.
Yeah, because I've noticed one of the most obvious signs of aging is when the lip becomes lower and you can't see your teeth.
And this one is like you have a elongated, columella, like you have your nose distance to your lip distance
becomes longer.
Yes.
Like, damn you, gravity. Everything has gone south. My boobs, my face.
Everything going
to the ground.
Yeah.
Okay, great. So now we've got the lips, and then we'll talk about the facelift in a moment. You can't do, I know you can do breast surgery, but not in Nulook.
No, the thing that we can do is the fat graft.
Oh, fat graft.
Yes, not the implant one. The reduction is, it depends. If the patient is not have too big boobs, maybe we can do it here. But the thing that we do is usually a fat graft. So the transfer from your belly to your because aging and motherhood,
Yes, if you breastfed or your boobs have gone
yes,
bigger and then smaller. Yeah.
and then smaller and going down.
Yes.
So sometimes a few patients like, can you feel this?
Yeah.
Yeah.
That's an interesting one actually, because I've heard that the success rate of the fat surviving is a little bit more challenging in the breast area.
Yeah.
Is that
Yeah.
right?
Yes, because it's our own body fat, so they like, that's our friend, why do you stay there, why don't you I absorb you, you don't need it to be there. Yeah,
Yeah.
that's a challenging part about the fat crowd.
So to overcome that, would you put more fat than what's needed to begin with on the assumption that you're going to lose some?
No, it's still the principle is how big is the pocket. We're not gonna like,
Ah, okay, so it's how big is the
yeah,
pocket, but you have to manage the client's
yes,
expectations
yes,
that they might look really big at the beginning, but it may
and
go
then
down a little bit.
yes, because sometimes the patient like, I want to be like the one who's still swelling, the
Yeah.
swelling one.
People love it when they're swollen. I've seen it with
Yeah,
facelifts as well. They're like, I have no wrinkles. And it's
yeah,
like, it's because you're swollen.
but when the swollen is like wherever reduced, it's like, why is it getting smaller and smaller?
Oh,
Yeah.
yeah.
So sometimes I set the expectation with the patient that you can do maybe not just once, you can do it the fat transfer maybe two times or three times if you
Okay.
feel like you want it to more bigger, because like I said, the fat is getting absorbed by your own body, so they still have a chance, so we still have a chance to fill it again.
Yeah. Okay. Amazing. That is so interesting. So just a quick one on the clinic in terms of what it can and can't do, because at the moment it's only day surgery,
Yeah.
which means that you would come in, have your surgery, recover for a few hours, and then go to your accommodation.
Yes.
So it's technically considered minor surgery. Is that right?
Yes.
Is there plans for you to do major surgery where they can stay overnight in the near
Okay.
future?
Yeah, we're still kind of working on it,
Okay.
because it's with the regulation and everything.
Regulations, licensing, all of that kind of stuff.
Yes.
Yeah.
So we try, and because the demand is also because
Yeah.
they love to come here, feel the like the cozy place and
Yeah.
everything. And can we do like more?
Yeah.
More like, but sometimes we have the like that we're just a 1 day service.
Just
So
1 day
yeah.
service at the moment.
So we, if the major surgery is like tummy tuck or something like that,
They would need to
really,
stay in like a night or two because they probably have drains as well.
and
Yeah.
everything, and also the observation after the surgery. So we need to have more nurses and everything. But we kind of working on
You're
it.
working on it. So it is, stay tuned, watch this space little message.
Yes.
Excited for that. Okay, quick one as we work down the body. Boobs, tummy, you've just touched upon the tummy.
Yeah.
Fat transfer to the bottom.
Yes. Yeah.
Butt lift.
Yes.
Quite popular, you think?
It's not as popular as the fat transfer to
the boobs.
Yeah, but also it's a few patients ask about that, and usually the patient they already have the butt, they have a really good shape, but on the side they got
want,
like a dead.
Yeah.
That's the one who there's a few patient asking, why can't I have that fat in there? Why?
Yeah.
When I stood at the back, it's still good, but at the side, it's like something like
it goes in.
Something like that. So it's like I want to feel so it's like plump, peachy.
Looks more peachy and more full.
Yeah. That's the kind of patient that looking for a butt lift.
A butt lift, yeah. Okay. Is there anything that you can do from the waist down?
Usually Thai lipo.
Apart from the bum, yeah.
Thai liposuction and calf. Sometimes few patients.
What you do to the car?
Just lipo a little bit.
Really?
Yeah.
No way.
Yeah, like so we usually do the lipo a little bit on the calf and the knee area, because sometimes patients who get weight loss, they have like everything going down. Yeah. So they have like back up your knees, use like a little bit and the calf is still have like a redundant fat, so we can
You can do that.
Yeah.
Have you ever done a fat transfer to the calves if somebody had too skinny legs?
No, not
No,
yet.
it's not. It's not really a thing at the moment.
Yeah,
Okay. Amazing. So we've done the head to the toe. Now let's go back to the face, because I'd say the face is the most popular thing that people want help with. So as patient concierge services, we work with many hospitals and clinics and doctors, and I would still say facelift is definitely the most popular, and everybody thinks that they need dip plane or deep plane is the only option. But there is another option, which is the mini facelift. So mini facelift can be done on day surgery, and you can do this. You can do deep plane too,
Yes.
but not here
Not
because
here,
it's
not
still
here, yeah.
considered major.
Yes.
So a mini is considered minor. What is a mini facelift? Why is it called a mini? Is it like not as deep? Is it?
Yeah, mini facelift. Why we call it a mini facelift? It's not. First is the scar is not that much.
Show us where the scar goes.
So the scar is usually around here. You know, when you see the patient with full facelift or deep plane, they have like a really big
behind
scar,
the ear, around the hairline at the back. Yeah.
But in mini facelift, we usually have from the hairline here, just around this here,
just to like the bottom of the earlobe.
Yeah,
Okay.
something like that. And then after that, usually we're not going too deep to the under. We call it the
smash.
Yeah, smash. So just the smash, and we usually not cut it the smash. We just like lift it up and then stitch it.
Do you put so I've been trying, and obviously I'm not medically trained, but I talk to lots of doctors all the time, so I'm learning a lot. So once you lift up the skin, you have the smash, and then underneath the smash is considered the deep plane.
Yes.
So in the smash, do you put any stitches in to pull it up?
Yes.
You do?
Yes.
So it's like a loop?
Yeah.
Yeah, that's my understanding.
Yeah.
So you do pull the smash up, but you don't cut it?
Yeah, not cut it.
Okay.
Just pull it.
And it's a permanent stitch that's inside?
Yes.
So it's not like a thread?
No.
It's definitely not like a thread. Yeah. So it's better value for money, really, isn't it?
Yeah.
Than the thread, because the thread
is like you have the thread, and then when I don't think the thread is also like going into the mass that they pull it up. You know, when we do the mini facelift, we see this mass. We saw what's make your face going down.
Okay.
So we pulled it up, you know, in the third lower of your face here. We pulled it up and make you feel like it's not like a thread, you know.
It's a fully refreshed.
Yeah, fully refreshed look here.
Okay.
Here and for a mini, because it's so short scar, usually the patient, the good candidate one is usually more younger patient.
Okay.
Yes.
So younger being maybe like under 55?
Yeah,
Depends on the skin quality?
On the skin quality, but usually patient around maybe early 40 to 50, it's quite a good candidate, because they're not they still have a good skin laxity.
Okay.
And especially on the neck, they're not too like.
Will there be an improvement on the neck as well? Or just a little bit?
Just a little bit. That's why mini facelift is not a good option for people who already have a big
dropping. Okay.
jowls.
Yeah.
But if you feel you in early 40 or 50, usually it's not that bad, you know. So we still have like lift it up, and then the jowl is gone. Like.
Okay.
Yeah.
Okay.
So usually in younger patient, the better.
Okay. And if somebody had a mini facelift, say, 50 years old, the likelihood of them needing a deep plane, would it be a little bit less, do you think? But
yeah, it's not like a less.
I mean, like 15 years later or something.
Yeah. But usually, for mini facelift, it lasts for about 5 to 10 years.
Okay.
5 to 10 years. So, like, reduce your age for 5 to 10 years. So, and then after that, if the patient would like to have a deep plane, they can like maybe with the combine with any minimal invasive, maybe they can like improve to another 5 years, something like that.
Okay.
And then they can do the deep plane, because the deep plane we go to the deeper tissue.
Yeah.
And really risky about around the area, but actually it's more permanent. Yeah.
Okay.
Yeah.
It's more permanent.
Yeah.
Would you say it's less risky
In
with the mini?
Yeah, it's less risky.
Yeah.
It's really it's not like not any risk at all, but less risky.
But you're not going around the nerves as much as a deep plane.
Yes,
Yeah.
we just like open it up and then get smash, and then we call it smash application. Lift it up and then remove the skin, and then everything's done.
Oh my God, I want one. You're selling it to me.
Yeah, because mini usually younger patient the better.
The better.
Yes.
Okay.
Yes.
Fantastic. Thank you. I do have some other questions
Yes.
prepared. If it's okay with you, I'm just going to check. So I have to put my glasses on. I'm at that age now where I wear reading glasses. Yeah. So we've talked about the day procedure. We now know about the benefits of it. And we now know how it differs from a deep plane to a neck lift. Is there anything that we could talk about in terms of the recovery?
For mini facelift, the recovery is more faster than
Faster.
before. Yeah. You still have the bruising and swelling and maybe a numbness around the area, but it's not as much as a deep plane. So the mini usually will wear off, and the swelling bruising will be wear off around maybe 2 to 3 weeks after the procedure. So
Okay.
it's like, even because the younger patient, the like the healing process still in a good way, so usually can be like more faster than that, and then the patient with usually in productive age, they still want to work and everything, they still can go to work maybe after a week, and then it's like it's a surgery, but it makes no you've been going something
Like it's like not too. I know trauma is a heavy word, but it's less trauma to the face and body to recover from. And I guess because it's minor surgery, there's less anesthetic to recover from.
Yeah, usually we do it under sleeping anesthesia. So the patient we put to sleep, but just a light sleep.
It's still a light sleep. Yeah.
It's not like a general anesthesia like you do a major one.
Yeah, I understand. Yeah. Okay, great.
You have to maybe age.
Okay.
First, okay. Maybe your the patient is around early 40, 45. The earlier the better, because you have the sign of aging, like folded here, nasolabial fold here, you start to have a jowl, something like that. You can start to consider to have a mini facelift, and usually maybe not around the upper part of your area, but this one you still start to feel like a little bit saggy, something like that. But especially jowls that patients notice about, there's something here that cannot be removed with anything, and then this one, the marionette smiles and everything. This you have like a slide that you can start to get the mini face.
It's really good to hear that, actually, because a lot of women that I notice online, they seem to want to wait until it's quite bad, because it's like they want to get their money's worth.
Yes.
But actually, it is a really good time to get it in like your late 40s, a nice little freshen up, and know that you're going to be good for the next 10 years.
That's what I'm few patient also. I think I'm gonna do it in another like 10 to 15 years when they 45, another 15 years, then you 60. When you do the mini facelift, it's not gonna do nothing. It's like, okay, why not now? And then feel much press, much less risky surgery, and then you can maybe in another 15 years to start to do the deep blend, then it's okay. But you still, if you manage to maintain your face and maintain with your skincare and everything, maybe you can get it more.
Yeah. Another thing to take into consideration as well is the menopause phase.
Yes.
Because a lot of women, if they're post-menopause, they will have really noticed the collagen has dropped in their skin from like their estradiol or estrogen.
Yes.
So
like sudden.
it's because I have just turned 49 and I've just started to notice
okay.
Yeah, and I'm like, okay, so the next 5 years, I'm probably going to notice it faster.
Yes,
So
yes, yeah.
yeah, so I guess a mini facelift is really good for like the qualifying stage would be
Yeah,
between
yeah.
40 and
And
50.
yeah.
Depend, and if the skin's in really good condition, 50 to 55, then
Then
possibly.
yeah, yeah. So
Mm,
the earlier the better, because in mini facelift we're not like remove or like dissect so deep. So the earlier the better. So yeah, like if you like, sometimes if you patient with early stage of menopause, premenopause, is really having a lot of sign, and then they start to, what happened with me? Why do I have
when
this?
did that happen?
I thought my face is still, but why start like everything is pulling down?
Yeah.
That's the start.
That's the start.
Yeah.
That's a really good indication for.
Yeah.
I use the word qualify because I do think it is. It's an assessment that
Yes.
needs to say yes or no
Yes.
of whether
Yeah,
you qualify
yeah.
for a mini or whether actually you're past the phase of a mini and now you
Then
need to look at a deep plane. Yeah.
yes.
Okay.
Yeah.
Awesome. Great. So the last couple of questions.
Mhm.
What do you personally find most rewarding about doing facial surgeries like the mini lift?
Most rewarding
For
thing
you,
for
yeah.
me, I think when I see the face of the patient after, it's like you see, you see, like you're not seeing someone else. You're still seeing your patient, but they have sparks in their eyes that sparks different. You know, it's
Yeah.
like they I kind of, when they still have the bandage on and everything,
Yeah.
they still have like, oh, thank you, like
Yeah.
yeah. And then after that, sometimes a few patients I feel like, is that you? Is that really you? I feel like sometimes like
Wow.
that. Is it really you? Yeah. And especially patient after they get the stitches removed, the bruising and swelling wear off, and they start to cut their hair, they start to more freshness. And it's like, I feel like, I did that.
Oh my God, I love that.
It's like, really? I did that? It's like,
Yeah.
what did I do? It's just like, oh, wow.
It's like you can really see your contribution to her life.
Yeah. It's like, but the spark in their
The
eyes.
sparkle in the eyes. Yeah.
Like they feel like, even just like a upper bleph, and then they come. I really love it.
Yeah.
It's the patient's eye sparks differently.
They spark
It's like
differently.
like you give something to light up them. Like, wow, I did that. Like, wow. Wow,
That is
really?
so good. Yeah, it must be such a good feeling because
Yeah.
a lot of the women, they've been struggling with, they may have high self-esteem and high confidence, but it's
Yes.
like it can be really annoying when you look in the mirror and it's like my appearance isn't matching how I feel. Like,
Yes.
and I want to
Yes.
fix it. And you
Yes.
give that gift to them.
Yeah. Yeah, but sometimes I feel like I like ask myself, did I did that?
You did that.
Wow.
Yeah.
Love
It's
that.
like if you see a beautiful lady walking down the street and she's your patient, you're like, I did that.
Yeah. Sometimes, wow. Yeah, and some patient like send me their video. It's me after like 3 months. They have their bangs on and everything. Really? And then I see the picture again. Oh, this. Oh, really? Again, and then me also surprised with that.
Oh,
Wow.
I do. I love that. Okay. So, Dr. Sita, thank you so much. This has been wonderful. As we come to a close, is there any message that you can give to the viewers if they're feeling nervous about booking for a mini facelift or lipo or any type of procedure? Is there anything that you can say to them?
Okay. Aesthetic surgery is not about all this like major and haunting things. So you can start with a minor one, maybe a blepharoplasty one, or a mini facelift one, or you just want to like do a liposuction one around specific part of area. And then also you have Karen here who will be with you and support you through everything. So yeah, I think the earlier the better.
Yeah, and you've been doing this for 6 years. You've
Yes.
done like what, 50 facelifts so far. You've done lots of different procedures. So the message is you're in good hands and your results will be fabulous. Thank you.
Thank you,
Thank you.
Karen.
Thank you.